In my latest video on IT band syndrome, I talked about one really common presentation of this injury, and this type of presentation is actually more related to changes and breakdown in the runner's biomechanics as they fatigue when they run. With that type of a presentation, you're dealing with more of a biomechanical issue, not a mobility issue. In this video, I want to actually talk about a type of IT band syndrome that does quite well with mobility work. The key to this is that you're targeting the part of the IT band that can be stretched, not the part that can't. In my last video, I talked some about the complexities of IT band anatomy. I want to talk specifically about the slip of the IT band that actually goes in and ties into the patella. If you develop stiffness right through here, what's going to happen is that patella is going to be pulled into what's called a lateral tilt. When this happens, you can get some compression along the undersurface of the patella and the femur. So with this type of IT band pain, this really is kind of a blended injury. You can get pain from stiffness in the actual IT band and also pain in the underlying bone from that stiffness causing too much compression. So people that have this actually do really well with stretching and foam rolling when you target the right areas. We know that the IT band is very, very strong and it has multiple attachments along the femur. So you can't stretch it very well and you can't foam roll it very well. But what can you foam roll well? You can foam roll the quads. So the quads have extensive connections to the IT band. So if you can actually get in and target the quads near where the IT band inserts the patella, this can do a lot of really good things for people who have mobility restrictions here and help take some of this compression away from the outside part of the patella. Medial patellar mobilizations can also be helpful for this. This is where you actually get in and have someone help you glide the patella inward to provide a real targeted localized stretch here on the outside of the patella. This specific technique can actually be super helpful for getting rid of IT band pain that's related to IT band stiffness. If you do well with medial patellar glides, then reinforcing it with a medial patellar taping technique can also be really helpful. The final thing that you want to look at when it comes to IT band mobility restrictions is up at the hip where it attaches. Remember, the IT band starts at the hip and ends at the knee. So we want to look up where it originates at the hip. One test that can be helpful for looking at this is the Thomas test. I've got another video out that I'll link in the description that shows how you can use this test to tell if you have stiffness up at your hip that might be also contributing to stiffness at the lower part of your IT band near the knee. The aim of this test is to actually get the hip to where the muscles on the front side of the hip are in a lengthened position. So you're getting a nice good stretch here up near a muscle called the TFL, which is where the IT band starts. So as that lengthens, if the distal part of the IT band is tight and the TFL up top is tight, then what you're going to see very clearly is that as the knee lowers down towards the ground during this Thomas test, the foot is going to spin outward due to stiffness here and stiffness here. So if you test tight on this test, you're also going to want to target some stretching and mobility work up at the hip. So since the IT band can't be effectively stretched, try doing some of these stretches instead if you think that mobility issues are feeding into your IT band symptoms. My recommendations for this are to first start out by working out any mobility restrictions you might have in your outer quads. See the video linked in this description for more on this technique. To provide even more localized work, have someone assist you with medial patellar glides to target the outer soft tissue structures that tie into the patella. If these seem to help with your symptoms, then reinforce these mobilizations with a medial patellar glide taping technique. And then finally, if you're tight at the top part of your IT band, then you want to stretch the tensor fascia lata. An effective technique for this is the kneeling doorway stretch. To do this, get your femur flush with the doorway, then roll your pelvis back and lean to the side slowly about 10 times. If you know of anyone who struggles with IT band syndrome, please share this video with them and hit that subscribe button.